Hello and welcome to the anatomy school, and I am going to be presenting a workshop about the anatomy of the breath. I'd like to thank Lucy and Rachel at the Whole Health Project for inviting me here to share my passion about anatomy. And there is the possibility, if you are not able to watch this lecture over the next hour, that the lecture is going to be posted in the Whole Health Project after I have finished the live. So don't worry, you're not missing out. It's possible to catch up on this workshop. So at the bottom of the event that I have created, there is further information to be able to check in with myself, Rachel Ellery, or the Anatomy School. I have my website that I've connected here. And there's also a donation box at the end of the live that I will be doing. So if you feel the need to be appreciative of the information that I'm more than happy to share with you, then please go ahead, and thank you so much for any donation that you choose to make. Otherwise, let's get stuck in and start to get to know the diaphragm and the anatomy of the breath a little bit more. A big thanks to Rach, and a big thanks to you guys for having me at the Whole Health Project. Much appreciated. Okay, so what's the first thing we do when we come out of our mummy's tummy through the birth canal or through the sunroof if there's a cesarean section situation? The first thing a baby does is to breathe. And those doctors and nurses, they make sure that the airway is clear enough, and the child will go in to take that first inspiration, that first breath of their life, the air, the prana, which is the source of life. And there's some amazing anatomical structures within that little baby that change and shift through that pressure change of being inside mummy's tummy and then coming to the outside world. There's certain areas within the cardiovascular system that actually flip over, which is where you may have heard in the past something called hole in the heart, which is where there's a flap that is created, and this flap reduces the hole between one side of the heart and the other side of the heart. So, excuse me. So that the baby, therefore, is able to take in oxygen, because otherwise the child takes on board different nutrients from mum via the umbilical cord. So if you look at a baby breathe, where do you really see most of the movement when a baby breathes? You really get to appreciate their abdomen, their belly raises and descends. It goes up and down, up and down, up and down with their breath, which is actually how we're meant to breathe. Now, in this modern day and age, we are in a situation where there may be restrictions of our breathing, whether it's maybe with clothing that might be a little bit too short. You've been out and you put your tight jeans on and you've gone out and you can't breathe into your belly properly, so you end up breathing maybe a little bit further up into the upper chest, which is not really beneficial for us. So I want to start to show you in relation to the breath and the thoracic cage. This is Charlie, by the way. We've got Charlie up on the wall. We can say a nice big hello to Charlie up there. And he's just going to be here for a bit of assistance in relation to the appreciation of our thoracic cage. So our thoracic cage, we can just kind of take a reductionist approach and start to look at the thoracic cage here, of which we can see that there's many ribs, and there at the back there is a spine. Okay, now within our spine we have different regions of our spine Not going to go into that fully today, but behind the thoracic cage here we have the thoracic spine, and there are ribs that come off every thoracic vertebrae, of which there are 12. So we have 12 ribs to the left and 12 ribs to the right, making 24 ribs in total. Some of those ribs are attached to the actual sternum itself, and other ribs, as you can see here, are free ribs, and we have a couple of floaters here at the bottom. Now these ribs interestingly have different movements that we can associate and appreciate how bucket handles work, and also how a pump handle works within our life. Now, if we can appreciate through our own thoracic spine, let's just place our hands, say, onto our upper chest and take a deep breath in through the nose and out through the mouth, I would encourage. So as you take a breath in, quite a deep breath in, we're going to start to appreciate which way does our upper chest move. Okay, and our upper chest and our upper thoracic cage moves forwards and upwards, very similar to that of a pump handle. And from the spine, where the joints attach into the spine, the ribs move forwards and upwards, and then they come back down. Okay, and there is going to be a sense of transition a little bit lower down through the thoracic spine. But let's now appreciate what happens to these lower ribs. The other handle that I was talking about is called a bucket handle. And we can actually see these here within the lower rib region on Charlie. And what we're going to see here is the lower ribs. Have a feel on yourself, because it's really interesting and quite important to feel this and experience and embody it yourself. And if you have your hands on your lower rib cage and take a deep breath in, which way do those ribs move? Big deep breath in through the nose, out through the mouth. And you can see there that we have this sense of expansion. And the sense of expansion goes out to the side. We call that laterally in relation to anatomical language. So our lower ribs go outwards and upwards, okay? Quite different to our upper ribs that come forwards and upwards. So this here is the difference between the bucket handle, the lower ribs out and up, and our upper ribs, which are more like pump handles, which allow the thoracic cage to expand. And what are we expanding our rib cage for? To get air inside of our spongy lungs, okay? Now, what is below our lungs and what is our number one muscle of respiration? Our number one muscle of respiration is the diaphragm. And this muscle is quite incredible in relation to its shape. It's like an umbrella. Here's one I had prepared earlier. So we have an umbrella, and the umbrella is really important in relation to our breath, okay? Now we've got structures underneath that diaphragm, and we also have structures that sit on top of the diaphragm, for example, okay? Which two structures sit on top of the diaphragm? We have, and they're actually connected, we have the two lungs, left and right lung, and then we have the heart that sits very much in the middle of our diaphragm, okay? And what structures, what visceral structures do we have underneath the diaphragm? On our right side, we have this big liver. And this big liver is really taking up a lot of contact underneath the diaphragm, even all the way to the back. And kind of crosses the midline a little bit and goes over to the left. Now, what have we got under here on the left side that sits under the diaphragm? We've got the stomach. And the stomach there is very closely linked because it has a tube that comes from our mouth, comes down, comes through the diaphragm into the stomach that sits around here. Okay, so I'm the diaphragm here, and on this side here we are the liver. Okay, and there's lots of other abdominal content down there for sure, But just think of these guys that are kind of like really cozy. It's almost like they're spooning and they're getting quite cozy and tight up into there. Okay, now I just mentioned that we have the esophagus, the food pipe that travels down through the diaphragm. And I'd also like to mention two other structures that pass through the diaphragm as well. And they are the largest artery and the largest vein in our body. Largest artery that's called the aorta, and the largest vein that is called the inferior vena cava, okay? And these two vessels are one bringing blood up from the lower part of our body, and the aorta is descending down from the heart to take oxygenated blood for the rest of our body that's below, of which there's quite a lot down there, isn't there? It's really got quite a job to do. So we imagine and we see the heart as a pump, but that is sitting up on top of the diaphragm. But we've really got to appreciate here how the diaphragm is also a pump. And there is a shift of pressure above the diaphragm in the lungs because there is a sense of a vacuum within this area. There's not quite such a vacuum effect in relation to our abdominal region. So there's not a huge change, but there is a change of pressure above the diaphragm in relation to our lungs and when we breathe in and when we breathe out. Now, what happens to our diaphragm when we breathe in? Because we've got to look at those connections of the diaphragm to our cage, which I will look at in a minute. Now, the diaphragm, when we breathe in, we need more space in our lungs, don't we? We need more space for the air to fill up our lungs. So what happens to our diaphragm is that it contracts. And as it contracts, this central part of the diaphragm, the muscles contract it and descend the diaphragm as well as the ribs coming out. So we've got this sense of the diaphragm widening and flattening, creating more of a space above, which is where the air comes into. And then when we breathe out, expire to breathe the carbon dioxide out, we get a sense of then the diaphragm rising, the space above is reducing, and our ribs are coming back from that sense of being inflated on the breath in. So inspiration, the diaphragm descends and the ribs will widen, creating a bigger space for the air to come in. And then as we breathe out, the diaphragm, our rib cage narrows, the diaphragm domes again, and the lungs are reducing in their size because they're not inflated with air. So the ribs, the diaphragm, it's everything synchronizing really remarkably well together, isn't it? And yes, the diaphragm is the number one muscle of respiration, but wow, we've got so many other muscles that are attaching onto this amazing thoracic cage because we need muscles to help lift those upper ribs. They're really cheeky little muscles. They lay here within the front of the neck. If I take a deep breath in, can you see some of these muscles standing up? Okay, and those muscles there are called the scalenes, and there's 3 of them, and they are responsible for attaching onto the first and also the second rib. So they're working from above in relation to lifting the pump handles. And we've got some other muscles responsible for encouraging the lower bucket handles as well. The intercostal muscles, all the muscles that lay in between these ribs, and wow, there's a lot of them. Every single rib in between has these intercostal muscles, and there are 3 layers of those muscles helping to change the structure and the volume and the capacity for this amazing thoracic cage, which is there for what purposes? It's there for protection of our vital organs, whether it's the heart, the lung, some glands that sit up through here. We have the diaphragm, we have below the diaphragm, we have the liver and also the stomach. And the spleen. The spleen's up on this left side, tucked away up in the back around the 10th rib region. So it's got a sense of protection. Now you think protection, wow, we're going to need a hard hat kind of thing for protection, but it needs a sense of compliance, doesn't it? It needs a sense of movement. We need to have this movement in relation to our breath. It needs compliance. So as well as this bony protection, we have rather a lot of cartilage that's sitting up here through the front part of our sternum, to the left and the right side of the sternum. You can see these structures here that I'm pointing to on Charlie. These are cartilage, costal cartilages they're called, and they are there for a sense of compliance. Have a feel how much you can actually move and spring your ribs. And if we're talking about movement, what movement, what asana in relation to yoga, what asana and what movements do you think the thoracic spine are going to love? It's going to love, the thoracic spine loves to be able to twist, almost like wringing out the spine, wringing out the ribs. Really helpful for encouraging the breath, really helpful for people with breathing dysfunctions, for example, with asthma, pneumonia, bronchitis, people that have breathing dysfunctions, people that have bad posture. You might have Johnny at home that sat on his phone and he sat here with his head forwards and he's on his phone and he's not finding that full capacity for his breath. For athletes, people with breathing dysfunctions, people with anxiety, wow, the breath is our number one consideration for people with anxiety and stress, which there's quite a few of those in this world right now. So breathing, to teach people how to breathe is just key in relation to finding balance within the oxygen and the carbon dioxide levels within our body that is so important. It's really important in relation to synchronizing in our breath that we want to be able to connect with our parasympathetic nervous system. The parasympathetic nervous system is about our rest and our digest, which is obviously so important. If we're not resting and we're not digesting, then what are we doing? Our abdominal muscles or our stomach content doesn't have the ability to digest the food that we eat. So we're not necessarily what we eat, we are what we actually digest. That's something to really consider, because people are like, oh, you know, you've got a good healthy diet. Well, what if you're not digesting it properly? So we've got the balance of oxygen and carbon dioxide, so important for our internal environment. Because if there is an imbalance there, we are looking at acidity versus alkalinity. And imagine if your internal environment is working in an acidic manner. Yeah, doesn't even sound very nice, does it? So if we're in that acidic situation environment, how do you think our body's going to respond? It can respond via, we've got these amazing little receptors in our body called chemo receptors. And if there is a difference within the oxygen and the carbon dioxide, we can see and we can appreciate that these chemo receptors actually shift our breath. So it may be that we yawn because we've got to get more carbon dioxide off our body. It may be that it increases our respiratory rate, or it maybe slows it down. So the balance in relation to our pH balance internally is so very important from a food intake point of view, as well as breathing. So thank goodness for those chemoreceptors. I'm not going to go on about them too much because that's kind of getting into geeky physiology that I have to say I'm not actually the best at. So I'm going to stick to the anatomy side of things. Okay, let's get back to our umbrella. We're going to get back to that diaphragm. Educating people about the diaphragm, I think, is so important, because where is it? Where is the diaphragm in our body? A lot of people will go, oh yeah, it's just here, Just there. That's where it is. Well, does it go anywhere else? Or is it just there? Because if we look at the umbrella analogy that we saw earlier on, this lovely green umbrella that makes me look a bit green too, we can see that it's got a full circular free edge to that umbrella. And that free edge has attachments into the thoracic cage and also comes right down into the lumbar spine, which is really low down. Now, can you see this little dot up here? Okay. This little dot is at the tip, the very tip of the sternum. And it's called the xiphoid process. It is a cartilaginous little tip at the end. You may like to just follow your own sternum down, and as you follow your sternum down with your fingers, you will come to the very end of your sternum, and that little cartilaginous tip is called the xiphoid. Be careful, it might be a bit tender. And from there, the diaphragm is going to continue all the way around the rib cage of the ribs, or of the cartilaginous rib region of the 6th, 7th, 8th, 9th, 10th, 11th and 12th rib. Now this is like 3/4 of the attachments of the diaphragm nailed already. From the xiphoid all the way down, all the way down around to the 10th, 11th and 12th rib. Now from there we've got to consider a couple of interesting muscles that are within this region of the body. The first one is called the Quadratus Lumborum. Bit of a mouthful, just know it as the QL. It's a little bit easier, the QL. And it's pretty much sitting where my hand is. It comes from this 12th rib and comes all the way down onto the crest of the pelvis, all the way down here. And the diaphragm is picking up the fascia, the fascial attachments to these muscles. It's not attaching into the muscle itself. So imagine this. Imagine that this here is a muscle and my tight here is the fascia, and this would be the diaphragm. And the diaphragm is going to be attached onto the fascia that covers that muscle. So really, really interesting that if we have any diaphragmatic problems in relation to the breath, it's really a good idea to consider what's happening with this muscle called the Quadratus Lumborum and this other cheeky muscle that we have through the front of the lumbar spine that comes all the way to this little tip here on the inside of the longest bone of our thigh called the femur. And this muscle here is called the psoas muscle of the soul, a very interesting muscle in relation to emotions that can be stored within this muscle. It's almost like our running muscle, exit left, get me out of here, sympathetic, flight, fright and fight system. Breathing starts to increase, the psoas muscles running and getting us out of here. So we've got this fascial attachment to the Quadratus Lumborum and the psoas. These are the small little ligamentous kind of attachments that are, or tendinous attachments that go over these muscles. And then we can see how the diaphragm plugs in or anchors here to the very front of the spine. And you can see here that there's a long ligamentous line here. And that ligamentous line, this is where the diaphragm plugs into the back of the spine. So have a look from where my fingers are here to this little nodule of where the diaphragm is at the front. It's really quite different, isn't it, in relation to the height of the diaphragm attachments at the front of the body and the height discrepancy through the back of the body. So the diaphragm's going to lift up and over an arch down and be able to come down and attaches here into the front of the spine. Wow. So have a think, therefore, where are our lungs, our actual lungs per se, where are they sitting at the front? Do you see that there would be more lung surface area exposed at the front of the body or at the back of the body? And yeah, it's at the back of the body. Our lungs here are just literally, if you can feel through your rib cage, it's just behind where my boobs are, and it's behind this region from the front of my body all the way down to those ribs. And then see if I circle all the way down to the back into my lumbar spine, and we just place our fingers here into that soft region. This is where our lungs go to in the back of our body. Wow, they come down really quite low, don't they? And where do we encourage people to breathe? We encourage people to breathe a lot in relation to their abdominal. Take a deep breath in into your belly. Okay. Which I've had numerous questions. It's like, well, yeah, great. Okay, I understand what you're saying, but why do we breathe into our belly? It's because there's this exchange in relation to the diaphragm descend, so it's going to create more of a belly sense of your belly rising. Now, what if we start to cue people and start to give that people that there is the understanding of really there's no front, back, or sides of our body because we are this one continuous cylinder. And we have this cylindrical attachment of our diaphragm. So we can really get a sense of appreciation of these whole three ends and this 3D nature of our breath. Breathing into the front sides, the front back, and the side backs, as well as the back of our body. And this is so important to therefore experience that whole of the diaphragm. So different exercises for the breath are so very important, of which we discover through the pranayama of yoga. We experience different breathing in relation to Pilates, breathing out on the effort. We do all these interesting Anulom Viloms, different techniques, the Kapalabhati, the fire of the breath of fire. And what I would love for you to do with me right now is to place your hands back onto your lower ribs, because I'd really like for us to get a sense. If your hands are big enough, I'd ask for you to cup around the whole of your rib cage from the front to the back. And what I'd like for you to get a sense is a sense of just having a look at my hands again and see about the sense of the lateral expansion. And see how much expansion we can actually get through our lower lungs and our lower ribs. Wow, it looks like my right one's moving a bit more. Now let's see if I can just do it on my right side. Okay. See how I have the muscular control through the muscles of my rib cage. I'm not side bending my body, but I'm breathing into that rib cage. And then let's have a go on the other side. Get a sense of breathing into the whole of the rib cage, into the left side. And keep going, and one more into that left side, getting that sense of that lateral expansion, those bucket handles moving. And those bucket handles, wow, that really brings a sense of not just breathing into our belly, in that we really need to have this lateral expansion to appreciate our breath in different ways in relation to the concept of our classification of asana. If you're doing a side bend within your asana, say Trikonasana, how about we cue and we get a sense of breathing into the more expanded side? Same within a child's pose. If you want to crawl your hands around to one side, let's breathe into the rib cage and open the rib cage up like a Chinese fan. It's a lovely cue, getting that sense of opening. And with that sense of opening up through the thoracic cage, we then start to experience our conscious breath into different regions of our thoracic spine and our rib cage, which is so beneficial. Being within the child's pose, we can experience more of the breath into our back of our bodies in relation to, we actually have a bit of pressure on our tummy because our tummy's on our knees in a child's pose. then we can start to experience that full sense of breath into our back body, into those back ribs, into that lower area of our spine. And this is really important in relation to people that have different postures within their spine. If you've got somebody that has like a sticky outy bottom and has an increased curve within their back, do you think it might be good for them to experience how to breathe into that back body that is shortening? Oh, yes, it so is. I think we are all, and we will all benefit from many different breathing exercises. But getting this sense of the expansion through the back of the body, understanding that the diaphragm descends when we breathe in and the ribs get wider with that bucket handle nature, is so important that we can appreciate that concept, because that may get us away from breathing with our upper chest, which can lead to imbalances through the muscles of the neck, can lead to neck tension, can lead to our upper ribs working too much. And there are some very, very, very important structures that supply our whole arm. Now, these structures are, I like to abbreviate it, saying a vein, a V, a vein, an artery, A in the van, and an N for the nerves. It's a van. It's a V-A-N, and we've got a very large vein, a very large artery, and a lot of the whole neurological brachial plexus that supplies our hand. Now, if we're over breathing with our upper ribs, we may compromise these structures, which may lead to a variety of different arm symptoms, which may look like pins and needles, coldness, or a change of temperature. Oh, it just feels a little bit strange in relation to the touch, the pins and needles, the pain, etc. So upper rib breathing can be quite challenging. Now, imagine what happens in relation to our rib cage if we have this forward head carriage, which I'm seeing a lot in this day and age with the computers, with these digital nomads that are going around with not having a good computer setup. There's a lot of this forward head carriage that really destabilizes our whole balance. It creates a shift within the musculature that attaches onto our thoracic cage, which can then influence so many different things within our life. So head posture is so important in relation to how our shoulders sit around our thoracic cage, and it's so important for our breath. Okay, so breathing. Let's think of, I would like to just share with you some breathing dysfunctions, because within this world, I think there are more breathing dysfunctions that we actually really take into consideration. We've got to look at, I mentioned about the tight skinny jeans earlier on, getting a tight skinny jeans on and not having the capacity to be able to let the abdominal region relax. What about if you're wearing a bra that may be too tight, or a top that's too tight? It may restrict that sense of our capacity to be able to breathe into our maximum. Or not even maximum, because we don't breathe into our maximum at rest, do we? We're just kind of breathing. Sometimes people stop breathing and they didn't even really knew that they'd stopped breathing. Talking about stopping breathing, what about sleep apnea? The snorers. Those snorers are pretty wicked in relation to what happens to their internal environment when they stop sleeping or they stop breathing, maybe up to 100 times per night. Wow, that is a lot of time not breathing, and it compromises our internal environment, as I'd spoken about before. Really, really important. So a stiff thoracic spine, people that maybe computer a lot, people that just are doing one kind of range of motion in a day and that are not twisting. We don't twist to hunt for our food anymore. We don't twist so much to throw the dog the ball. We're not twisting and rotating around as much in life in this electronic age, opposed to the agricultural age that we once have been in, and even the industrial age of moving and more manual labour. So let's think about those twists that I was mentioning earlier on. So very important for our thoracic spine, our twists. Wring it out. Wring it out like an old rag and feel how that's going to increase that sense of expansion and possibility for our amount of oxygen that we want to get in our body, because oxygen is good stuff, isn't it? And we want to get rid of that carbon dioxide. So other breathing dysfunctions. Anyone want to make a comment on any other breathing dysfunctions that we may see? People with sinusitis. People, this day and age, we've got so much hay fever going on, and people are sniffling and snuffling and maybe get blocked sinuses, which then creates a sense of changing their breath. They may not want to breathe up through their nose because it's blocked, so they end up breathing within their mouth. And this is our first port of the respiratory system, is our nose. We need to warm the air up in our nose, and we need to filter it with the hairs in our nose, some having a few more hairs than others. Anyway, enough about that. Breathing dysfunctions, what else do we see? Smokers, toxicity. What else? Bra sizes, clothing, we've spoken about that. Posture. If you're pregnant, or if you're Johnny sat at home on the computer. So posture is very, very important. The biggest breathing challenge and dysfunction is people with stress and anxiety. And what happens to their breath? It becomes more shallow. They may even stop. The breathing gets a little bit more upper rib breathing, which may therefore compromise the neck. And the anxiety is where we're taken into that sense of that flight, fright and fight, sympathetic kind of, oh my goodness, not coping. The breath is going to change, which therefore shifts our oxygen and carbon dioxide levels. So breathing, starting to create a sense of breathing with the four